Okay, I messed up my camera so bad I have to use the selfie window. And hopefully this is not blurry. But I was on Fox News Channel. I was on channel 617, I think. Fox Business. And unfortunately, my recording got compromised somehow, and I couldn't upload it or share it or anything. And I deleted it from my device because the storage was too full. Now I got to do the whole thing all over again. But there's just one problem. I'm not on channel 617 anymore. I'm on channel 600. So and on channel on my original video had the information straight from the horse's mouth, straight from Dr. Fauci's mouth. But now it's gone. Um, you know, the what you call that? The news conference. You know what I could have done? I might do it. The news conference is on the internet. I could just go on YouTube and put the YouTube on the TV and redo it. But anyway, here, CNN was talking about the same subject. So I decided to do this again. I'm getting tired of this whole which channel I'm going to use and all this BS and whatnot here. Live for coronavirus vaccine. A place for mom. Here, at least I got this commercial. CNN Global Town Hall. Join Anderson Cooper and Dr. Sanjay Gupta with special guest basketball great Magic Johnson. Live for coronavirus vaccine fears. Thursday at 8. This is really sad. That's sad. They're saying that a lot of black people in the South, in Louisiana, you got to think about why would those white students who were sick get on an airplane and fly all the way down there to do Mardi Gras and spring break. And now that because of those fucking white kids did that shit, you got black people dying in the South, not up here, in the South. You got black people dying more so from the coronavirus than any place else in the country. And now they're also starting to add the inner cities to the list where black people are dying in higher numbers than anybody else. But who started it? These white children, these young whites who and anybody else, whoever went to Mardi Gras. Anybody could go to Mardi Gras. Spring break is for college students, but Mardi Gras is for anybody. But they said that the thing that caused it to spread was that those spring breakers, those 20-year-old white kids, went to Mardi Gras and they were spreading it like that. That's what they said. Because what happened was the ones from the north, from Massachusetts, and they call them I forgot what they call them, but the ones from the north, the white kids from the north, they went down south to Florida and to Louisiana and whatever, and that's how it spread at Mardi Gras. And then of course these fucking Southerners. Or the other issue about these goddamn Southerners is they don't never. Whenever something is serious, they don't never shut down. You know why they don't never shut down? Because they know only black people are going to suffer, and they really don't need to take in any more black people. And Alabama didn't shut down. That's very sad that somebody is using this channel. I guess it's Marianne. Somebody's using this channel to educate the population, assuming it's black people, I guess. I don't know why they got it on CNN. Educate the population on coronavirus using Magic Johnson. I didn't want to do this on channel CNN. I wanted to do this from Fox Business Channel, channel 617 over here in this house. But my video got compromised, so I'm just gonna. President and Dr. Anthony Fauci acknowledging this is not the press conference. The other one was the press conference live. The U.S. Surgeon General this one is not. That black Americans are at a higher risk for the virus because we're more likely to suffer from diabetes, heart and lung disease. That is a concern of mine that I have talked about on this program since the outbreak of the pandemic. For example,
African Americans make up 30% of Chicago's population, but account for 72% of coronavirus deaths in that city. Last week, Senator Kamala Harris talked with me.
You don't think they tried to spread that shit on purpose?
Based on race.
You think that these college students are stupid? Why did they do that? Why did they do that? I think that a lot of these, I think that they did it on purpose, but I didn't know that it was going to start killing more black people. I thought that they were just being assholes and decided to go to spring break. This is the same exact thing that happened the last time there was an outbreak of this sort when I was in college. The same thing happened. I don't think it was Hurricane Katrina, but it could have been a year after Hurricane Katrina. It could have been one of the years after Hurricane Katrina when, let me press play. These them white college students, because that's who it was. It was the white college students that came from Massachusetts. Sorry to put the racial part on there, but that's who the fuck it was. So if you want to generalize, take out the word white and just put college students, the spring breakers.
So black families and children are 20% more likely to have asthma. Black families are 40% more likely to have high blood pressure. Black women are 3 times more likely than white women to have lupus. Viruses that affect the respiratory system have a direct impact on people who are suffering from sickle cell anemia. So what we know then is that this virus, by its nature, preys on people who have pre-existing conditions.
So just so you know, when I spoke to Senator Harris about racial disparities in healthcare in this country, that set off some critics who claim that I'm racist, when I was just pointing out the facts, just so you know. And now the data is clear. Coronavirus is disproportionately impacting and killing people of color, and for the reasons that are based in medicine and science. But they also tell us something about our society. More tonight from our very own Dr. Sanjay Gupta. Sanjay?
Dom, there is another risk factor when it comes to the coronavirus pandemic and how it's affecting a particular group of people, and that is race. As we get closer and closer to the apex, as everyone's calling it, of this curve.
I don't think anybody, honestly, if you are not desperate, if you're not in a desperate situation, I really don't think a black person should vote this year. Okay? I don't think you should open that can of worms. But that's how I think. If you're not desperate, don't bother. But if you want, you go and, I don't know why I'm giving adults advice, because nobody listens to me. So why should I even bother giving any advice? But anyway,
we wanted to find out just how much does race play a role. Turns out a lot. Why? I decided to find out myself. In the beginning, COVID-19 was far away, and it didn't even have a name.
It was coming over to our shores from people who had traveled.
But once it got a foothold in the United States, its true self was revealed.
Once people got infected, because of their diabetes and heart disease and the like, that they would get it more severely and be at higher risk of dying.
Dr. Kamara Jones is past president of the American Public Health Association. I was really struck, Dr. Jones. We're both doctors, and as I was hearing the story, it sounded just all of a sudden tragically familiar. Is this a familiar story?
What we see is so familiar because the conditions of our lives haven't changed significantly. And so what's happening is that we are carrying the burden of these limited opportunities in our bodies, and it shows up as the diabetes, the heart disease, the hypertension, even in terms of, immune compromise and all of that.
Already, we are hearing from some officials that blacks have been disproportionately hit by the outbreak. Early data shows that in Michigan, where I grew up, 14% of the population is black, though they make up 41% of coronavirus deaths. In Illinois, 15% identify as African American, but they make up 42% of deaths. Louisiana's population is 32% black, which accounts for about 70% of coronavirus deaths. But here's the problem.
All of those places are up and down the Mississippi River. So how did Chicago get so bad? I know that the Mississippi River don't got nothing to do with jack shit anymore because we're in the age where you can have airplanes. But once these goddamn motherfuckers went down there and did what they did and spread the virus, I just my geographical me studying geographical history, I know that things spread up and down the Mississippi River. I just know that. And I'm going to press play again. I did not want to do this fucking shit on channel CNN. I wanted to do the live press conference and let people decide for them. Goddamn. And not have any commentary.
The problem, according to Dr. Jones. As inadequate as testing has been for the country, the problem is even worse for African Americans.
Our whole national testing strategy has started out as a clinical strategy, not a public health strategy. That, of course, has disadvantaged the whole nation in terms of knowing who's infected. And I am told also that it has been harder for many people of color to get the test just because of where testing stations have been located.
While blacks are less likely to be tested, less likely to be treated, they are more likely to be on the front line, essential workers upon whom we all depend.
We out here as public workers doing our job, trying to make an honest living to take care of our families.
Detroit bus driver Jason Hargrove posted this online on March 21st.
It is not as easy for them to shelter in place. And it's not as easy because they might have front-facing jobs like home health aides or bus drivers or postal workers or working at Amazon and the like.
For you to get on the bus and stand on the bus and cough several times without covering up your mouth, and you know that we in the middle of a pandemic, that lets me know that some folks don't care.
4 days later, Hargrove, who was 50 years old, became ill. He died last Wednesday. It's still unclear how he got COVID-19. Don, there's no question there have been long-standing structural inequalities as we laid out there.
Just a moment of silence for a second. I can't take this shit. This is too much. I'm fine. But this is too much, and I didn't want to be bothered with this much heavy stuff. I just wanted to do my regular video, and it got compromised. Now I got to do it over. I need a moment of silence. CNN, you're welcome. Donald Trump says that you have bad ratings, so you're welcome.
We couldn't even get into all the various things that sort of comprise that. But I think there's two things outstanding. One is that we need to continue collecting data, and that data needs to be broken down by demographics so we can really understand what's happening here. But also, if there is a really tragic story of the rationing of care, hopefully that doesn't happen. But if we get to that point, we want to make sure that those same structural inequalities don't manifest with regard to rationing as well. Don?
Dr. Gupta, thank you very much. I appreciate that. Let's discuss further now with Dr. Brian Williams. He is a trauma surgeon and the co-director of the surgical ICU at the University of Chicago. Doctor, it's a pleasure to have you on. Thank you so much. Appreciate you joining us.
Well, thank you for having me, Don.
You're in my former city of Chicago. The disparity in deaths among African Americans there is startling. We know other places like Milwaukee, New Orleans, and Louisiana, where I'm from, where I grew up, struggling with the same issue. What are you seeing where you are?
Well, here in Chicago, as you mentioned, we just had a report that 70% of the deaths from COVID are African American patients. And right now we are at the University of Chicago. We still have capacity. We have beds and ventilators. So we're working with the state and the city to prepare for that surge. But I've worked at big public hospitals in Atlanta and Dallas. So it was not a surprise to me, although it's still very distressing to learn how devastating this virus has been to Black Americans.
All right, having said, I'm glad you said that because I want you to listen to what the president said at the briefing tonight about African American victims getting hit hard by the virus.
We're trying to find out why is it that it's 3 and 4 times. Now, maybe that's not going to be the final number, but why is it 3 or 4 times more so for the Black community as opposed to other people? It doesn't make sense.
It doesn't make sense to him, but I mean, we get it, and part of which is what Dr. Sanjay Gupta said in his piece. It's racial disparities, it is healthcare disparities, it is pre-existing conditions, it is poverty, and on and on. Go ahead, doctor.
Well, I think it's very important for us how we shape this narrative when we talk about race being a risk factor for COVID-19 and a host of other medical conditions. We have to look at structural racism and how that is impacting these patients. So when we talk about race, we put the onus upon these individual patients. When we talk about structural racism and the economic and environmental and healthcare barriers that vulnerable groups have to overcome to get healthcare, then that's something that we collectively can all work to close those gaps so that in times of crisis like we are now, and we're seeing Black Americans being devastated by this, we can come together, close those gaps, and provide adequate treatment for everyone who ends up in a hospital.
There's one thing that has been very disturbing to me, and that is this sort of cartoonish rumor that has been going around saying that African Americans think that they cannot, get the coronavirus because they're immune to it. No one that I know, no Black person that I know takes that seriously. They know that it is a joke on the internet. As a matter of fact, as I was going around the weeks before that people had a shelter in place as I traveled to DC to do work or to Florida, wherever I was going, I would see African Americans in masks, people who were taking it seriously. So I find it disturbing that people are spreading that as if African Americans are that stupid to believe that they are not susceptible to this disease. That is simply not true, doctor. Can you please talk about that? Because I don't believe that that is true. I think that that is just a stupid rumor.
Well, it is absolutely false. COVID has shown that it has no respect for anyone's race, ethnicity, economic status. We've seen heads of state get infected. We've seen homeless people get infected. So this notion that race or ethnicity is somehow protective against the virus is absolutely false. But what is important to recognize that certain races and ethnicities are more vulnerable to the negative impacts of the virus due to structural inequities that persist within their communities, such as access to healthcare. Black Americans are 2 times more likely to be uninsured than white Americans. There's economic disparities. There's environmental disparities. So the question to ask is not, are Black Americans immune to this disease, but why are so many Black Americans in vulnerable positions and suffering as a result of this pandemic crisis?
You've been very helpful. Thank you, Dr. Brian Williams. I really appreciate your time and your expertise. Thanks so much.
Thank you for having me. Appreciate it.
There's been a lot of talk about using hydroxychloroquine to treat coronavirus patients, but it's not the only drug being looked at. I'm going to ask a member of the team researching antibody therapies and a former FDA official about the potential treatments out there.
I'm going to actually let him just tell me what's the name of the other sick thing. They don't even have a name for it, actually. The anti-malaria drug.
University's efforts. Can you explain this antibody therapy for us and tell us what you're finding?
Yes, well, antibodies are the body's natural immune system. It's the way that you fight off viruses and the way that you prevent getting sick again when you're exposed. So right now you'll see lots of groups are trying to harvest antibodies in plasma and move them from an immune person who's recovered to another person at risk. And so that's being tried. And what we're actually doing is trying to do that in a way that makes antibodies into a drug. So we look through the immune cells of a person, the white blood cells circulating in their body, and we find particular ones that are good for SARS-CoV-2, and we capture them, and then we can synthetically make the antibody from that person in the laboratory and eventually in a factory. And so we're developing these antibodies very, very rapidly, and we hope to be using them in clinical trials in the summer.
I want to bring in now Dr. Peter Lorre. He's a former FDA official, or Peter Lorre, who is an FDA official and the president of the Center for Science and the Public Interest. So let's talk about hydroxychloroquine with you. That's what we're hearing about the most. You worked at the FDA. You're concerned about using this drug as a large-scale, uncontrolled experiment to fight coronavirus. Why is that?
Well, the way that we've made progress in medicine.
Okay, guess what? I don't care. You know why I don't care? Because I found out last week that my aunt, who has epilepsy and lupus, one of her medications is hydroxychloroquine. She's been taking that shit for decades. Must have been for decades. Hydroxychloroquine, also known as Plaquenil. So fuck that. Anyway, after all this time, I listened to, now it's back to me. I listened to young Pharaoh's video entitled Anthony Fauci and Bill Gates should be indicted immediately. So listen, later, maybe tomorrow if I feel like it, I'll do it all over again and get the press conference where Anthony Fauci, Dr. Fauci, the short guy, the short white man, was talking. And you can get a picture on it of him talking and saying exactly what what's his name, Don Lemon, was doing all of his journalism over. This same issue came out in the press conference today. And they were ahead of CNN. Why were they ahead of CNN? Because they were ahead of CNN. What that got to do with anything? Well, that's the person with the actual job. The doctor and the president of the United States. That's what I'm concerned about, not this shit. Because I am not desperate. And when November gets here, if I'm desperate, I will kill myself this time, and I'll do it successfully. This is not going to happen to me again, where people are not supporting me and nobody's paying attention. People ignoring my phone call. I'm not going through this shit no more. And no money in it. Not happening. Not happening. It's not happening. Nobody's going to. Well, I need somebody to help me kill myself. Maybe somebody will shoot me in the head. If you love me, you just do what I ask you to do. But anyway, back to what I was saying. Because don't nobody appreciate my mind, but you keep me alive because it's better to keep my brain active. Y'all niggas don't give a fuck about me. Because I benefit the planet. Basically. Anyway, it was Donald Trump on the president on the, obviously in the press conference, and Fauci. And I think I cut off my video. It was only a 5-minute video. And so I finally listened to Young Pharaoh's thing. And like I said earlier, whatever your situation is, I wanted to put both sides of the situation. Here I got to repeat myself. Both sides, whether you want the Trump, I said for mainstream political purposes, black people. If you're gonna vote, that's what I mean by mainstream political purposes. If you're gonna vote, the Trump as the selection, as your candidate that you are gonna vote for, Joe Biden. I said Joe Biden or no Biden, and I'm gonna leave the Democratic Party's candidate like that. Joe Biden or no Biden, or some other alternative, or you're not gonna participate at all. I wanted to give both sides of the situation. This time around, I think CNN is supposed to be liberal news, right? Because everybody on this channel, all the men on this channel, all of the primetime guys, they're all gay, right? So I guess this is the liberal news. I don't watch CNN. And so I guess this time around, I got their perspective and not the right wing's perspective, saying the same shit, giving you the same information. One at their press conference this evening, this like 6 or 7 o'clock, I think it was 7:30 or something, and this one at 11:30 at night. That's it. That's all I had to say. And I was gonna say, I'm gonna repeat myself. I'm gonna say it again. Forget about the election. I hope the election is going to be suspended. That way I don't have to think. All I got to do, I don't got, And then, yeah, at that point, y'all would have to catch up with me. I mean, I'm sorry. At that point, it would be that I would have to catch up with you people. Because they're trying to slow me down. Because I'm going in warp speed. I'm starting to realize what this is all about. I'm so much more ahead of everyone else. I don't need y'all. That's why I want to leave. And you want me to need you. You want me to get back on my knees again. That's what the fuck you want. And what I want is to move to another country. I don't like this place. And I know I don't like it. And I don't think you deserve for me to pay off my debt either. Because look at the troubles I'm having in my attempt to pay off my debts. I have about 5 of them. All over in different places. I'm going to stop now. I'm going to press the square in a circle. Goodbye.